Greetings. Greetings. Let us talk about hemostatic forceps. These are my acknowledgements. And today we will learn about the use of a hemostatic forceps and how to set it up and handle the device. Hemostatic forceps has certainly helped endoscopists in managing bleeding during resection of polyps, either during endoscopic mucosal resection or during endoscopic submucosal dissection. During resection, if bleeding were to happen, especially if there is a brisk bleeding that does not get controlled with snare tip soft coagulation, you can use a hemostatic forceps and apply soft coagulation to control the bleeding. And let us learn about how to set up the process for using a hemostatic forceps. It requires the use of a monopolar circuit. So to start with, the machine should be turned on, and if the machine is already on, you want to make sure that you select the soft coagulation mode. We talked about it in the electrosurgery section. With soft coagulation, the peak voltage will be less than 200. And once the machine is turned on, you want to make sure that the electrical circuit is completed by having a dispersive electrode or the dispersive returning pad that is placed on the back on a big chunk of muscle and hooked to the neutral electrode point on the machine. And then the hemostatic forceps is attached to the machine using the monopolar electrode outlet. When it comes to the parameters, the coagulation mode should be set up at soft coagulation, and depending upon what you're using, usually people use an effect of 4 and a wattage between 50 to 100 watts. I typically use 80 watts. And as you can see here, the outlet is monopolar outlet and a neutral electrode outlet. So let us look at the device. This device is similar to any of our other endoscopy accessories. It has a handle with a thumb ring, a slider to open and close the forceps, and an electric outlet. And you hook the electric outlet to the monopolar outlet of the machine, and before you give the device to the endoscopist, you want to close by closing the grip as shown here, and also check the device by opening the grip to see whether the device opens up and closing, and then give the device in a closed position to the endoscopist, who will insert it down the biopsy channel. And let us see how you control the bleeding here. Here there's a bleeding after endoscopic mucosal resection. We set it at 80 watts, effect 4, soft coagulation. We gently grasped the bleeding vessel and cauterized it. And as you can see, the vessel has been cauterized and sealed with successful hemostasis. So in summary, we've learned that hemostatic forceps uses the monopolar system. It's a contact thermal modality using soft coagulation mode for achieving hemostasis, or sealing the vessels before cutting in endoscopic submucosal dissection. Thank you.